Every day across Canada, thousands visit an ER, waiting long hours to be seen by a medical professional. On the other side, nurses and doctors are studying your charts, determining a course of action.
Hi, but not that high.
Have you ever wondered what they're really saying about you or your condition? Well, Dr. Brian Goldman knows. He's an emergency physician and the host of CBC Radio's White Coat, Black Art.
And welcome to White Coat, Black Art.
Thank you. Glad to be here.
In his new book, The Secret Language of Doctors, Cracking the Code of Hospital Slang, he pulls back the curtain to reveal the real conversations in the emergency room.
Why did you write this book?
I wrote this book because I've been trying to unpack the culture of modern medicine since I started hosting White Coat Black Art. And slang is a delicious way, it's a way of getting into the culture of medicine, because when, like eye rolls, like nonverbal communication, when people use slang, they often reveal things that they wouldn't necessarily say in regular speech.
Why do you need slang?
In the past, we used to want physicians to be emotionally detached, imperturbable, like, you know, nothing ever bothers me. But when you take that too far, you have health professionals who have PTSD, especially paramedics, burnout, moral distress, compassion fatigue. And frankly, if you can release some of that by a little bit of humor, dark humor, then I think that it's probably a lot healthier than bottling it up inside or maybe hitting the bottle, which can sometimes happen in healthcare.
When was the first time you heard slang used?
I was finishing my first night on call in a pediatric hospital. So first night where I'd been up all night looking after ill children and putting in IVs, and I was pretty haggard and tired. And my senior resident, who was kind of my dude, came up to me, was trying to teach me the ropes the night before, very reassuring, puts a friendly hand on my shoulder and says, "Well, Brian, how many did you box last night?"
Box.
As in put into a coffin. And I almost fell to the ground until I saw the small, until I saw his lips kind of form a smile. And then he burst out laughing. And at the moment, I was shocked. Then I was delighted that I had been introduced into the secret handshake. And it was his way of saying, you're going to be okay. These are tough times. You're going to be able to cope with this.
So let's test out a couple of examples from your book. What's a yellow, or who is a yellow submarine?
Who? I'm glad you said that, because what is a very interesting thing. A yellow submarine is a patient with advanced alcohol liver disease. They're jaundiced, that's why they're yellow. They have a big belly, so they kind of have the bow, like they look a little bit like a submarine. It's slang that I heard that was used on the streets of New York, in the hospitals of New York City circa 1970s. Obviously, it was around the time of the Yellow Submarine by the Beatles.
Frequent flyer. What's a frequent flyer?
Frequent flyer shows medicine as, it's slang at its most ironic, because a frequent flyer refers to a patient who comes back to the emergency department again and again and again. I have examples in my book of people who visited the ER 300 times in a 4-year period. So often that they're actually known on a first name basis by the staff who work in the ER or the hospital.
And they're not always life-threatening situations.
No, not always life-threatening situations.
What's an FLK?
That is a horrible 3 letters that I heard early in my training. FLK stood for funny looking kid.
Ooh.
And that is, it's cruel. It is, and it's objectifying, it's awful. It referred to a child who, because of facial features, had an obvious, clearly was born with a genetic abnormality or congenital abnormality. In the past, this would actually be written in charts.
Really?
Yes, and
everyone would know what it meant?
Everybody would know what it meant. There is language that's cruel.
Hollywood code.
Hollywood code or slow code. I like slow code because I think it's more descriptive. It refers to what appears to be a full-on cardiac arrest or code blue procedure. Everybody knows code blue. You're supposed to drop everything and run to the patient's bedside and do CPR, defibrillate, shock the heart, insert a breathing tube, put the patient on a ventilator. So a slow code, you walk a little slower. You saunter sometimes. You, at least according to the description, you're slower to determine that the patient's unresponsive, slower to begin resuscitative procedures.
So this is a decision by a doctor that the person's not going to live?
That the potential to bring them back is so small that it's futile.
Well, I guess one of those other euphemisms along that line is circling the drain.
Yeah.
So does that help you guys, or does that, like, what does that do when someone says he's circling the drain?
Circling the drain is one of many euphemisms, many slang euphemisms that I discovered, some I didn't know. Entering the drain is different from circling the drain. Circling the drain is kind of inevitable.
You still have a chance.
Entering the drain, you're teetering, and maybe you could be pulled back. So circling the drain says so much more than somebody is dying, because dying, that's ambiguous. It could mean drop everything and run to them and do CPR. Circling the drain says that the processes that are going on, the diseases, whether it's sepsis, it's often an infection and multi-organ failure, and if you've ever spent time with a loved one in the intensive care unit, you know what
But is this
that's
something
like.
that helps you with other doctors? Like, what does it accomplish when you lay that out?
It helps us reflect. It helps the health professionals who use it reflect on the fact that they are not going to be able to save this one. But I think we have an empathy gap in healthcare. I think we don't put ourselves in the place of our patients enough and their families. We don't put ourselves in the place of our colleagues enough. And unfortunately, that's where some of the slang is generated as well.